Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. Joining me here in our visual radio studio to talk a little bit about the upcoming cold and flu season, Dr. Sugar Singleton is here from San Juan Health Partners Urgent Care. Dr. Singleton, always a pleasure to have you here. Good morning.
It's always a pleasure to be here, Scott. Good morning.
Thanks
for having me.
You bet. Thank you for coming in. We were talking before we came on the air this morning that it appears flu season is underway, an early start, this year?
It's a very early start this year, Scott. You know, normally we don't tend to get into good cold and flu season until about December, but we're already seeing some positives. We saw them in Albuquerque a couple weeks ago. We are seeing them here actually at the urgent care last week, so we're off to an early start.
Okay, well, and so the word is going out for folks to get their flu shots as always, and it's really, really important. I mean, I know you've probably seen folks that maybe didn't get their shot, and they have a worse time of it, don't they?
Oh, absolutely. I mean, that is the number one recommendation that the CDC has out, is that everybody needs to get their flu shot. We certainly recommend it in children. Under age 5 is a very critical time to be getting it. Of course, babies can't get it until they're 6 months old. So above age 6 months, through the lifespan. People who are really at high risk of needing to have the flu shot because they're at high risk for complications. Babies, elderly people over to the age of 65, and people with certain comorbidities or other medical illnesses, we would say. So people who have heart disease, congestive heart failure, lung disease, asthma, COPD, emphysema, that kind of stuff.
Because the flu can really complicate those other existing conditions,
absolutely.
Right?
You know, back 10 years ago or so, we used to say that those were the main people who needed to get the flu shot because we worried about the complications. We worried about the serious hospitalizations, even leading to death. People with diabetes, people who are overweight, and then even some other people just because of their genetics, like our Native American population really need to get the flu shot because they're at higher risk of complications as well, and certainly there's a higher incidence of diabetes in that population as well. So we strongly encourage everybody to get the flu shot, but those people in particular.
Right.
So now, as of this time, CDC recommends everybody over the age of 6 months get your flu shot. I got mine today.
Okay, there you go. You're practicing what you preach.
Absolutely.
Which you always do, I know. So every season, right? Exactly.
It's a must-do.
And the timing is perfect because the hospital just announced earlier this week that they have scheduled their annual free flu shot clinics, and so we can share that information for our viewers and listeners who are watching and listening to us this morning, Dr. Singleton. But the first one will be coming up in a couple of weeks on October 26th, which is the ever-popular drive-through flu shot clinic.
Yeah, this is a great one. It's super convenient for the public. Saturday, October 26th from 9 in the morning till noon over at our Schwartz office,
right.
405 South Schwartz, corner of Maple and Schwartz, and you can just drive in, get your flu shot, and drive out.
They tell you drive in, have your sleeves already rolled up, and you'll be good to go. They'll just stick you in, off you go.
Absolutely. Roll the window down. It's better than McDonald's.
There you go. And it's free.
And it's free.
There you go.
Absolutely. All these clinics that are offered by San Juan Regional Medical Center are free flu shots.
That's true. That's true. So that's the first one, everyone, for your calendars on October 26th. The next one would be in Aztec at the Aztec Senior Center at the October 29th. And that's the Senior Community Center there in Aztec on South Park Avenue.
Correct. And again, that's all morning from 9 in the morning till 11.
Okay. And then the Bloomfield Senior Center will have one on Wednesday, November the 6th.
Yep. And again, that's a morning clinic from 9 in the morning till 11. Free flu shots for everybody who wants to come over to the Bloomfield Senior Center.
There you go. And just because they're at the senior centers doesn't mean they're only for seniors. Anyone can come to these locations,
everybody
right?
Can come, yeah.
That's eligible to have a flu shot.
Fill them up. Line them up.
That's right. And then the Lower Valley Senior Center will be having one on November the 7th.
Correct. And again, that's a morning clinic as well from 9 in the morning till 11 for everybody who can make it to the Lower Valley Senior Center.
Okay, very good. And again, it's important to get your flu shot. I know, as we mentioned just a few minutes ago, that there's another shot clinic that I want to mention at San Juan Health Partners, which is the office building there on South Schwartz, too.
Right. It's exactly the same place as the drive-up clinic is, I believe, at 407 South Schwartz. And this is an evening clinic. So all of the other ones that we've been talking about have been morning
Right.
free flu shot clinics. But this is, if you're a person that works 8 to 5, we want to make sure we have a flu clinic available for those folks as well. So this is a Friday evening clinic from 5 in the evening till 7 at night, and just drive into San Juan Health Partners. We're right across the street from the hospital at 407 South Schwartz. And that, again, is a free flu clinic, free flu shot clinic for everybody in the community.
On Friday, November 8th. And again, we'll repeat these at the end of the program, everyone, if you didn't catch all those dates and times and everything else. So don't worry, we'll repeat them. But this is something the hospital does each and every year, and I know it's just kind of money well spent because you are inoculating all of us against getting the flu and spreading it around, right? I mean, it really is one of those things that can cause a lot of damage and
Oh, absolutely.
problems.
The burden of flu is huge. Not only do we see so many people that are getting sick from it, but when you're sick with the flu, you really can't go to work. You really can't go to school. If your kids are sick, they can't go to school, and therefore you can't go to work. So it's a tremendous economic burden as well, in addition to just the dangers of the flu in general. And when people get the flu, they really feel crummy, and they feel crummy for about 2 weeks. So it's a big illness. It's a prominent thing for people to be aware of, and they should know that getting the flu shot will really make a huge difference. Not only can it prevent the flu, which is our big push, we want to prevent the flu, but some people will still get the flu even after they get their flu shot. But what we see in those people is that their symptoms are far less severe, and they're far less likely to have the severe consequences like hospitalization, pneumonia, death, etc. So
Right. And you mentioned that people still do die from influenza, right?
Oh, lots of people. We had a huge number of deaths last year in the flu season of 2018. There was almost 80,000 deaths in the United States. 79,000 deaths, I think, was the official number from the CDC.
Wow.
Yeah, out of about 49 million cases of flu in the United States last year. And, I mean, 79,000 people died. That's a lot of people.
That is a lot of people. And so, again, it's important to get the flu shot. Now, how do I know if I'm getting the flu and it's not just a bad cold? Are there differences between the two?
Sure. I mean, the biggest difference is going to be in severity. I mean, it's not that you don't feel bad when you have the cold.
Sure.
But the flu is just a bigger illness. Now, in addition to making that distinguishment between the cold and a flu, I also want to talk a little bit about influenza versus what people call stomach flu.
Okay.
So let's talk about that as well.
Sure,
so let's
sure.
go back to cold and flu. Cold is generally a minor illness. We see a lot more of the respiratory stuff going on, runny nose, congestion, a little bit of coughing. Sometimes you can see a bit of a fever, but not too much.
Okay.
And it's usually a gradual onset. You know, you feel a little sniffly one day, have a bit of a sore throat the next day, and a little gradually, a little worse, and so on and so forth. With the flu, it's an abrupt onset, Scott. And, you know, a lot of times people will know exactly the minute they got it. They'll tell you, I was walking down the store at Walmart, and I was on aisle 7 getting my milk, and all of a sudden I just got these shaking chills. So we generally see a lot of shaking chills, high fevers, body aches, headaches, fatigue, just more significant illness. It is a respiratory illness, so we see a lot more lung associations, a lot of coughing. You can still get some of the runny nose and the sniffles and that kind of stuff, but it's much more of a lung illness.
Gotcha.
So that's the biggest differences with cold and flu.
Okay.
It's that abrupt, it's more severe, it's more fevers, high fevers, chills, headaches, body aches, that kind of stuff.
And can last longer, too, isn't that true?
Yeah.
Than a
So-
regular cold.
Absolutely. So cold, you know, we all say 4, 5, 7 days. Flu can make you feel pretty crummy for up to 2 weeks. Also, in terms of exposing other people, you can expose somebody else to your flu even a day before you have it. You are contagious.
Oh.
So a day before you are experiencing your own symptoms, up to about a week, you can be spreading that flu virus. Every time you cough, every time you sneeze, anybody within 6 feet is getting those droplets
Right.
all over them.
Oh, yeah.
So when we say
And you
cover
don't-
your cough, cover your cough.
No kidding. Even if you feel good, because you could still have it tomorrow, but you don't know that yet,
Right.
is what you're saying.
Yeah,
So
unfortunately.
that's interesting. And so it is pretty contagious, is it not?
It's very contagious, yeah. I mean, when we are in a room with somebody, we're saying, you know, I know you're over there,
Right.
but you're within 6 feet, so try to cover your cough. Don't be coughing, sneezing on other people. We try to get people to wear masks when they come into the urgent care.
Right.
And oftentimes when the burden of flu is high in the community, we'll even wear masks as well, so we're double protected.
Sure. I know there's been years, depending on how bad the flu season is, when urgent care maybe has been shut down to to visitors, or the hospital even shut down to maybe some visitors to keep that from spreading among the population. So I know that's just on a year-by-year basis when those decisions are made. And that brings up a great point about, should I go to work? Should I just muddle through it and show up for work even though I'm sick and may have the flu and may be contagious? I'll just keep to myself and not bother anybody and try not to spread it around?
No. Stay home.
All right. Doctor's orders.
Like I said, you are contagious for a good 5 days after you start having symptoms. And so that means you're going to be spreading it to the other kids at school, your coworkers, your boss, your friends, your neighbors, your fellow church members, whatever. So
if I'm going where they are, right?
Yeah, we really recommend that if you have the flu, you've been diagnosed with the flu, go home, take some Tylenol, and just kind of keep your germs to yourself. Don't go shopping. Don't go to work. Don't go to school. Don't go to church. Don't go to the birthday parties. Don't go visit grandma, especially.
Right.
Just stay home until you're feeling better. And that generally is about a week away from school or away from work.
Okay. And will I know kind of when things are getting better? I imagine I'll probably feel better, right? But, I mean, it does kind of linger for 2 weeks, you said it could.
Yeah, it could. Generally, you're contagious for about a week, so that's what we recommend, staying away from staying away from school or staying away from work. And the big thing that you can use to judge of when to go back is about 24 hours after the fever breaks is a good indication of it's okay to go back to school or go back to work.
Gotcha. And again, this is the flu season that we're seeing an early start of. You were mentioning at the beginning of the program that there's already been cases here in New Mexico, and Canada, I think, is already experiencing some, and so we're seeing it early.
It in Albuquerque a couple weeks ago. We had some cases at urgent care last week here in Farmington, so we're seeing it very early.
Gotcha. And so again, folks need to get their flu shots. Now, I know you wanted to mention a little bit about the difference between influenza and what we hear of stomach flu. Those are different.
A lot of times people say, I've got the flu, and you say, well, what are your symptoms? Well, I've got vomiting, I've got diarrhea. That is what's commonly called stomach flu. It has absolutely nothing to do with the flu that we're talking about today, which is influenza.
Right.
So you can see some gastrointestinal symptoms with the actual influenza, a little bit of vomiting, diarrhea, nausea, but that is pretty uncommon in adults. It's a little bit more frequent in kids, but it's really not a main factor of the influenza that we're talking about. The flu that we're talking about is that lung illness, again, fever, chills, body aches, headaches, and that cough, the respiratory illness.
Right. So, Dr. Singleton, if I get my flu shot this week or at the clinics that are coming up in the next couple of weeks, will it last throughout the whole season, even though it's starting early? Will I be okay through March, I guess, or whenever flu season is officially over? Yeah,
you should be. There's no recommendations for getting a flu shot even when the flu season is protracted, which it may be this year because it is starting early, but who knows? Who knows when this will peak and how long it will last? We had a pretty long flu season last year, but it hit us late. We didn't start seeing flu last year until probably December, January, but we were still seeing positives way out into April and even into May a bit.
Wow.
So we have not had much of a break from flu season. We've just had a few months of good health, and we're already back into a bit of a flu season again. But it'll remain to be seen whether this is just a little peak or if we're moving into full-blown flu season.
Right. But remains to be seen, but better to be safe than sorry.
Absolutely, because it will take about 2 weeks from the time you get your flu shot until you develop good immunity. So get that flu shot today because it's going to be a couple weeks before that kicks in. And certainly with us already seeing positives in the community, there's absolutely no reason to wait on your flu shot. Get it now.
Exactly. And I know, as we mentioned, the hospital is having some flu shot clinics. We'll repeat those dates and times and locations here in a few minutes. But even your primary care physician, or I know some of the drugstores and employers are having all kinds of events as well. So there's really multiple opportunities to get a shot.
Yeah, anytime you can get your flu shot, get it early. Don't wait to come to a free flu shot. If you're at your doctor's office for something else, go ahead and get the flu shot. If your kid's school is offering vaccines, let them get their vaccine at school. Wherever you have an opportunity, if you happen to be in the drugstore and they're doing it there and you want to get it there, it's just better to go ahead and get it at your first opportunity.
Right. And I know that each year kind of the CDC and the governments around the world are kind of meeting to talk about the strains of flu that they see that are active from the southern hemisphere up to the northern hemisphere and things along that line. It's always kind of one of those things to kind of make sure you're mixing the right vaccine for the flu that's out there.
Right, yeah.
And it starts about, what, 6 months out?
The flu is an interesting virus, Scott. Yeah. It's not like many of the things that we vaccinate against, because it's a virus that mutates frequently. There's an antigenic shift and an antigenic drift, and that just basically means that this virus is constantly just evolving. And as it evolves and as it mutates a bit, the virus changes from year to year, and so it's constantly a guessing game for those scientists that are choosing what strain is going to be prominent. Certainly, it's an educated guessing game.
Right.
But if you recall, when did we see the H1N1? Like about 2009. It's been about
10
close
years
to
or
10
so,
years
yeah.
ago since we saw that.
Right.
I mean, that was a huge shift in the flu virus that year, and it really caused a nationwide pandemic because it was very different from what we were seeing. And so not only did we not have immunity ourselves from a previous case of the flu, but also the flu viruses that we were getting, they weren't working. So our immune system just didn't even recognize that new H1N1, and it caused a lot of illness that year.
Got you. But I would think that even if it's off or not quite matched as well as it could have been in previous years, getting a flu shot will certainly lessen the symptoms
Absolutely.
if you do contract the flu and help you maybe feel better sooner.
Absolutely.
If you don't have anything at all.
Yeah, and we're hopeful this year that it's going to be a reasonably good match. Last year we had a pretty good match. But again, the flu virus is constantly shifting itself. Luckily, we don't get those major shifts like we got in 2009 very often. So if there is a bit of a shift from year to year, hopefully it's a good match this year. And as you said, even if you do contract the flu and you've had a flu vaccine, chances are that your symptoms will be much less severe and of shorter duration. That would be the hope.
Right. I want to ask you a couple of things about maybe things that people say to you that maybe they got the flu shot one year and then they got sick. And so they kind of avoid doing that. But do you hear that sometimes from some of your patients? And what do you tell them?
Well, essentially it's impossible in the current flu shot. I mean, that might have been possible 30 years ago. It's certainly not possible that with the way that the flu vaccine is developed in this day and age. So it's a misconception, although some people do strongly believe it.
Right.
Generally, what I would say is if you got the flu shot and you got the flu, there's a number of different possibilities. It's possible that you already had the flu when you came in to get your flu shot, because you can be have the virus before you're symptomatic for at least a day, so that could be a very close correlation.
Right.
It's also certainly possible that while you were in the waiting room at your doctor's office, the person coughing next to you could have given you the flu. And again, it does take 2 weeks after you get your flu shot before you have full immunity. So during that 2 weeks, maybe you're out shopping, you've touched a shopping cart, you've rubbed your nose, and the person that had that shopping cart before you was sneezing on the cart or whatever. So there's a number of different possibilities. However, you cannot get the flu from your flu shot.
Okay. I wanted you to say that, because for me to say it doesn't mean anything, but for you to say it means a lot more. So I think that's important for folks to remember and to understand. And again, I think from folks who've gotten the flu, they only need to maybe get it once before they're probably on the bandwagon to get their flu shot every year if they didn't have a shot.
Absolutely. There are some side effects from the flu shot, Scott. It's not completely a benign shot. Your arm will get a little sore. Mine's already sore. I told you I got that shot this morning, and it'll probably be sore for a good 2 to 3 days even.
Sure.
And you can get a bit of an immune response, so you might even feel a little bit... you sometimes think you're going to get sick, but you don't quite get sick, so you feel maybe a bit achy, a bit chilly. You're like, I'm not sure if I'm getting sick or not, but then you don't.
Right.
That's just the body mounting an immune response. So people may feel a bit sort of under the weather for a day or two, but it's not an actual illness. It's just your body saying, oh, there's something there. I'm going to recognize it, and that way I'm ready for it if I really get hit with it full blown. Right.
And that's what it's designed to do, is to get your body to kind of work on its own immunity too.
Right.
With all these things that are being introduced to it.
Correct.
And I've always heard that it's best to get the shot in your dominant arm, because as you move it, that kind of helps move the thing around and maybe lessen the pain that you might feel.
The more the blood flow, the better the movement. Yeah, that's what I did. I got it in my dominant arm this year.
All that stuff. So it does work. Dr. Sugar Singleton is my guest this morning from San Juan Health Partners Urgent Care. And again, if folks do get sick, I mean, again, that's what urgent care is for, I suppose.
Absolutely. Come see us.
If they can't get into their primary care physician or just feel awful, they can come see you and you can figure out what's going on, right?
Absolutely.
That's important.
We'd be happy to see you for your colds, your flus, your sore throats, any ailment that is concerning you, come in and see us at urgent care. We're a walk-in urgent care. Our motto is we treat you like family because we are your family. A lot of us were born and raised in the community, and we're happy to take care of you. And you know, as we get into flu season, sometimes there's a bit of a wait, but we do our best to get you in and out quickly.
Sure.
And give you the best care possible.
Right. And I always like to talk a little bit about your story, talking about being born and raised in the community, because you are a local girl. You've been here all your life, and are a great success story, I think, to someone who followed their dreams and is giving back to the community.
Thank you, Scott.
If you don't mind me saying.
Yeah, no, thank you. I appreciate that. Yeah, born and raised here. I'm a graduate of Farmington High School. Actually, a graduate of San Juan College as well.
Right.
And then I went on down to UNM and got my bachelor's degree at UNM in biology. And then went to UNM Medical School and did my residency in family medicine. And I've been working for San Juan Regional Medical Center for about 14 years.
Very good. Well, and here you are, and it's great to have you to again continue to give back to the community and keep us all healthy as best you can.
Doing my best.
That's right. That's
Saving
right.
lives.
Exactly. Flu shot clinics, again, everyone. We wanted to repeat those dates and times, so if you don't mind, we'll go over them one more time. The first one is coming up on Saturday, October 26th. It's the drive-through clinic right there outside of the office, right?
Yep, that is right there across the street from the hospital, right on the corner of Maple and Schwartz. And again, it's drive-through, drive in, roll your window down, and we'll get you in and out quickly.
Roll the window down, roll your sleeve up, and bing, bang, boom, and you're done. That's it. That's how it works.
Couldn't it be any easier? There's no excuse. Come on down.
That's right. Tuesday, October 29th is in Aztec.
Yep, that one's in Aztec. It's a morning clinic at the Aztec Senior Citizen Center. It is open to the public, so it's certainly open to kids and adults and seniors as well at 101 South Park, the Aztec Senior Center.
Okay. Next one's in Bloomfield on Wednesday, November 6th.
That also is a morning clinic at the Bloomfield Senior Center. And again, all of these free flu shot clinics are open to the public, no matter what age, even the ones that are at the Senior Center. Bring your kids, bring your family. Everybody's welcome. That one on November the 6th is from 9 to 11 at 124 West Ash Avenue in Bloomfield.
That's right. And then there's one in the Fruitland area, Lower Valley Senior Center on the 7th of November.
Yep, that one's also a morning clinic at the Lower Valley Senior Center.
Okay, very good. And then there's one back at the medical office building.
Yeah, now this last one is a good one for working people who
Right.
have to work from 8 to 5. So if you recall, the ones we've talked about so far, they've been early morning clinics, which are sometimes inconvenient for folks like you or me. We have to work every day. So this one is an evening clinic at 407 South Schwartz. Again, that's right across the street from the hospital. It's Friday, November the 8th. It's from 5 p.m. to 7 p.m. Super convenient. Stop by, and again, these are all free flu shot clinics for the whole family.
There you go. And I know from the information that we got from the hospital, from San Juan Regional, they mentioned it's kind of a first come, first served.
Yes.
There's a limited supply, I think, of vaccinations for each clinic, so once they do run out, they're out.
Yeah, they're out. When they run out, they're out. So get in quickly, but we do want to encourage everybody in the community to come in, get your free flu shots. And certainly as we are doing the flu shots clinics early on, if we notice that we're getting great community response, hopefully we'll be able to build up those later clinics if we notice we're running out.
Sure.
So we really want to make a big push in line with the CDC recommendations that everybody over the age of 6 months needs to get a flu vaccine, and that is the single best thing you can do to prevent the flu. There's some other things we can talk about to prevent the flu, but the most important thing is please get your flu shot.
Right, and I always hear how important it is, too. If you're maybe a caregiver for an elderly member of your family, it's important for you to get vaccinated, of course, so you can protect yourself, because you'd feel horrible spreading it to a family member.
Absolutely, yeah.
And things like that. Yeah. What else can we do to protect ourselves then? You mentioned cover your cough. That should go without saying,
I mean,
right?
the biggest thing is washing your hands. Wash your hands frequently. If you're working
Can I just rinse them under the water and then leave?
Well, you know, it's better to sing happy birthday while you got soap on them or
there
something
you go.
like that.
That's the thing,
But
right?
I think we recommend about 20 seconds is a good hand wash.
Okay.
If you don't have access to soap and water, at least use the hand-based sanitizers. The alcohol-based hand sanitizers. Those are better than nothing.
Okay.
But lots and lots of hand washing, especially if you're out in the community. And then also, you know, don't be in such close contact with people during cold and flu season. We're very much a handshake population around here, but it's okay to fist bump during flu season, elbow bump, whatever.
Right.
And certainly if somebody's actively coughing and sneezing, no need to shake their hand.
A wave from afar.
Yeah, give them a good wave. But yeah, lots of hand washing. Certainly keep yourself healthy, Scott. I mean, taking a multivitamin every day, making sure you're getting plenty of sleep, trying to avoid stress, getting your exercise, eating healthy, drinking plenty of water, just maintaining your own health is important to keeping your immunity up.
That helps our bodies kind of protect itself a little bit too, right?
You know, I feel like when you're getting a bit of an illness or feeling like you're coming down with something, I think vitamin C and zinc helps. A lot of the research on that has been mixed, to be frank with you, over the years, but every time I start to get sick, I take a handful of vitamin C and a couple of zinc pills, and I do that for a couple of weeks, and it makes me feel better, so I tend to promote it with my patients. So vitamin C and zinc, I'm a believer in.
There you go. Well, it tends to work, right? At least as for you.
Absolutely.
So,
and then, cover your cough, as you said. Have some tissue handy. If you're coughing and sneezing, best if you can either cough into your elbow or cough into your shirt, something like that, or a tissue. If you are in any kind of a public place, if you're a teacher, if you work in a healthcare place, I mean, actually in any office, really, where there are other people around, it's a good idea to clean your workspace every morning. The places that everybody's touching, like the light switches, the telephones, the kids' desks, toys, iPods, iPads, those kind of things that are frequently being touched by different kids or different people in your office. If you can just get in the habit during flu season to clean those diligently every morning, that's a good way to prevent the flu as well.
Great advice. We've done that here, I know, at the radio station when there's been a lot of our coworkers who have been ill or something.
Yes.
The doorknobs, the telephones, other things you mentioned.
Absolutely, yeah.
Great advice. And so, again, and I know even for me, if I'm feeling a little ill or sick, and I don't know if it's flu or not, but I'm a little sniffly, I may, someone comes to shake my hand, I may just hold off and say, I don't want to do that, but it's good to see you, and just leave it at that, and not worry about it,
Certainly.
That's another way to do it. So.
Yep. I think it's totally reasonable.
Very good. Well, I'm glad to hear you say that. Dr. Singleton, great to have you here. Thank you so much for your time this morning.
You bet. Thanks for having me, Scott.
We are out of time, but it's going to be another flu season off to an early start, as you said. So, again, important for everyone to get out there and get a flu shot.
Wash your hands. Get your flu shot. If you're feeling sick, come see us at urgent care.
There you go. Good advice. Thanks so much.
You bet. Thank you.
Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.